Dr. Kuba is a proud Dallas native. She received her bachelor's science degree from biology at the University of Texas at Dallas. She then earned her DDS degree from Baylor College of Dentistry. While at Baylor, she completed her certification in pediatric dentistry in addition to a Master of Science in oral biology. She is an active member of the dental community, and Dr. Kuba helps educate future dentists as a volunteer professor at Baylor College of Dentistry. She was appointed by the governor to serve as a member of the state board's dental review committee. Dr. Kuba is a certified diplomat of the American Board of Pediatric Dentistry, and she has been selected to serve as a consultant to the board for the past 11 years. Dr. Kuba's mission is to work together with families to create a positive educational atmosphere where her and children can build positive dental memories, which lead to positive dental habits and health in the future. Thank you so much, Dr. Kuba. Take it away.
Thank you so much, Nathan. It's really exciting to hear of all the different places that people are tuning in. I know it's middle of January, don't know when and how that happened already. So I just appreciate y'all's time and tuning in. I am very excited about our topic tonight, and I will preface it with saying that this is not necessarily a glamorous talk, like a clinical hands-on one. I don't have any fancy photos and wow moment before and after pictures to show you because it's not a clinical presentation. However, I would like to say it is still quite an important discussion. And my goal for today is to help you integrate and make sure you're thinking of all the different things that need to be thought about while incorporating your laser. Certainly, the glamorous, exciting part is the clinical part and learning how to use the technology. But that goes hand in hand with integrating it and actually being able to use it, not just use it, in theory and on the side, but how are you going to make it a part of your daily workflow? So again, not the most glamorous topic, but definitely important. And because I have gone through this, years ago, I remember some of the things that were challenging. So I'd like to jump in and just get going. And again, I'll be happy to answer any questions. So this is what Nathan just went over. Who am I? And so I appreciate the introduction. So a little bit about my Waterlase history. It was 2015. I had never utilized any lasers in my practice, and I had heard about lasers, but it just seemed, kind of overwhelming. Nobody in my colleague circle was a user in Dallas, so something that I was not really familiar with. And then in 2015, I purchased the Waterlase I+, the all tissue laser, and also the Epic X diode laser. I purchased them together. And at that point, I did not have, I think now Waterlase allows potential providers to test out the laser in their hands. And I did not have that opportunity back in 2015. So I attended every and any course that I could to master proficiency in both lasers. So very exciting journey. But again, the clinical competency was only half of the equation. So what all did I need to do to incorporate it into the practice? So in preparation for this, I ran across this article in Dental Town. I don't know how many other people read Dental Town, but this figure caught my eye, and it was polling dentists. Besides the cost, what is the biggest obstacle in adopting new technology into the practice? So I thought, man, this is perfect for my talk tonight, because cost, of course, is a big consideration. And of course, this poll was not just talking about lasers. It was talking about technology in general. So an iCat or scanners in an ortho office or in a general practice. So it was talking about technology in general, perhaps new software, new dental software, et cetera. So I think 26% of dentists said that compatibility and integration were a concern. 26% of dentists polled also stated that logistics or disruption of switching to a new system was a big concern. 24% reported finding the time to train myself and train the team was a big consideration. You know, most of us in our busy practices, especially today in 2022, where there's so many considerations with COVID and changes, et cetera. So for myself back in 2015, luckily COVID was not an issue. So finding time to train myself and the team was a big challenge and consideration. I don't think any of us fall into this 24% of I'm content with what I have, because we're here listening and learning about the technology. So clearly we're all wanting to do better and be better and utilize technology that is available to us. So I'm excited. I know none of us are in that 24%. We are all wanting to integrate and keep up and be cutting edge. So anyway, again, I thought the poll was interesting because that's exactly what this talk is about. Are we going to let the logistics hold us back from utilizing equipment and technology that we know is better for our patients? So obviously there are many logistical steps that need to be considered for implementing your laser into your practice so that it doesn't disrupt your workflow and contributes to the efficiency of your workflow. That's the ultimate goal. And I've heard this sentiment pretty much with any potential laser user or purchaser that I've talked to. And I had the exact same sentiment. I did not want to purchase expensive equipment only to let it sit in the corner because I was clueless or overwhelmed with how to incorporate it. So the clinical competency was only half of the journey. The next step was, how am I going to incorporate this? I would like to say at this point, you know, being a pediatric dentist, I think one thing that makes it more interesting or challenging or just a different aspect, I believe, you know, in an endo practice or a perio practice, maybe even a general practice, and certainly I'm not one of those providers, so I'm making assumptions and guesses, but I think one thing that's unique to pediatric dentists definitely is the challenge of the patient. You know, what kind of patient do we have? And a lot of times with our pedo patients, you know, of utmost efficiency is of utmost concern. I may only have 7 minutes to get this done. And is this the patient I'm going to choose to utilize and practice on and incorporate new technology with the patient that I may just, it's tempting to just say, okay, I'm done, just go back to the traditional handpiece and move on. Or we have that parent hovering and buzzing over our shoulder. And do we really want that to be a moment of where I'm trying to utilize new technology and implement it? So the temptation definitely can be, okay, not this kid. Okay, not this procedure. Oh, not that one either. But my challenge or question to, you know, myself, to my team, and to other pediatric dentists, is that fair to the kid that my hesitation is holding me back from using technology that I know is going to be better for my patients? So that was another challenge that I presented myself with, was saying, no, you've got to figure out how to use this and how to be successful with the workflow so that that's not what's impeding you from providing the excellent care that I have invested in. So we've got here just, I kind of broke this down into a couple of different areas here. And certainly each one of these areas could be a webinar unto itself. Obviously, we don't have that time. But I, again, just want to challenge you to start thinking and going, okay, yes, I need to be thinking about that. Okay, yes, this is what I need to consider here. So just, I want this to just be for you, a moment for you to go, okay, have I thought about all of these things and how to organize yourself? On the surface, it can seem a bit overwhelming. And so that's normal. It's normal with whether it's the laser or the iCat or the CAD cam, whatever technology it is, that's perfectly normal for there to be some hesitation in incorporation. But I think the best way to tackle that is to organize yourself and to be prepared to say, okay, here's my checklist of things that I need to think about and organize and spend the time to prepare so that you do hit the ground running and you are able to incorporate the technology, whatever kind of technology it is, whether lasers or otherwise. So I do have a checklist for you at the end of this presentation that I hope will kind of pull it together and make it into little biteable, easy to-do steps so that you don't get confused or overwhelmed. So just like with anything new in our practices, all the COVID protocols that we've been dealing with for the last 2 years, it can all be overwhelming, but we've got this, we've done it before, we know we have to do it for the health and benefit of our patients. And so let's get into some of these considerations and know that stepwise you can do it. So let's talk about it. So first of all, safety considerations. I think this is kind of an easy one to think about because we all think about when we're practicing with the laser and in a seminar, we all know to put on our safety glasses. So this should not be a new or overwhelming concept. And I think we've all thought about too, you know, this the correct wavelength. So for example, if I was only using diodes, there is a particular glasses I could get away with using for that. But because I have both, I need to ensure that my safety glasses will encompass both types of lasers. The other consideration, especially in a pediatric practice, is who else is in the room? Do I have one assistant in the room? Do I have 2 or 3 assistants in the room? If I'm doing sedation in Texas, we need to have 2 assistants for the sedation appointment. So do I have enough glasses? If a parent wants to stay in the room and I'm allowing them to stay in a room, do I have enough for the parent? If it's 2 parents that want to be in the room. So just little things like that to think about. And certainly for our pediatric patients, do we have the right sizes available for our older teens versus our 6 and 7-year-olds? If we're choosing to see babies in the practice and we're trying to incorporate sternotomies or things like that for infants, if that's something that we're wanting to do, what kind of safety are we providing for those patients? In our office, we like these eye patches, but certainly there are goggles. Some people don't like the eye patches. So just the point being that there are several things to think about in a pedo practice, that it may not just be the one pair of laser safety glasses for the dentist and for the patient and for the assistant. And pedo has got a lot of moving parts and it's a little mini circus going on a lot of times. So ensuring that we've got what we need. I know nobody else would do this. I'm probably the only dentist that has played this escape card, if you will. But, you know, of course, now with COVID, keeping the limit of number of parents in the office becomes a little more easy to do. But back in 2015 and 2016, if I didn't want a bunch of parents and the little sibling in the room, sorry, Mrs. Smith, I only have 1 pair of extra glasses. Who's going to get them? Or I need this for my next assistant so that we can have a very smooth appointment for Johnny. And I know you want that too, so we'll put you in the hallway. If we need you, we'll grab you, but we need to make sure we have enough laser safety glasses for everybody in the room. Bye-bye. So again, I'm sure nobody else is that tacky that they would do that, but you know, sometimes that comes in handy. So kind of hand in hand, moving right along here, hand in hand with laser safety glasses, state board rules and regulations, another key, very unglamorous part of our day, but a very necessary part to make sure that we are following rules and regulations per our state. So in Texas, we have to designate a laser safety officer. You could assign it to a team member, or, you know, if you've got an admin person that's very good at keeping up with all rules and things like that, that might be the person you have. In our office, it is myself. I'm the one listed as the safety officer. And also in Texas, we have to register our laser like any other piece of radiology equipment that we've got. So just like with x-rays, x-ray units, our nomads, our laser has to be registered with the state per our rules. So if that hadn't crossed your mind, I'm throwing that in there too. And so that's going to vary state by state. So that's something you're going to want to look into. In Texas, as far as CE and licensing, we don't get a separate designation for your laser dentist. So for example, in Texas, to be a oral conscious sedation, if you're in Texas, we call that a level 2 provider. If you're nitrous provider, you're a level 1 provider, and that goes on your license. Nitrous goes on your license. So my license does not say that I'm a laser provider, but I do have to provide certain proof of certain CEs that I've taken, such that if I ever got audited, that I would be able to prove that, yes, I am educated and have met the requirements for being trained to use this piece of technology. So again, that's something you're going to want to check into in your own state board rules. Certainly your BioLase rep will be a great resource for different states, because they'll be able to guide you in knowing what your state may or may not require. In Texas, in-office signage is another requirement. So for example, I'm going to jump forward and then I'll jump back again, but in Texas, we are required to post a sign. It's a handmade sign that we made for ourselves, nothing glamorous, nothing fancy, but to meet the requirement, we had to post a sign in our waiting area and the reception area, caution, laser and x-ray machines are in use on the premises. So we've just got this tacked up there with all the other things that the state requires. I'm going to backtrack now. One more, let's see, where does it go? Here we go. Making sure that your space can accommodate laser safety. So in Texas, we need to make sure we have proper barriers in place. So for example, in my office, I've got 2 private operatories we use for operative treatment. So that's where we try to do our operative procedures. And so we've got a sliding door that's got, you know, kind of a hazy screen on it to protect, you know, so it's not just glass. And it's a sliding door we can close. And then we just have our laser signage on there that a laser's in use. It was more challenging in our hygiene bays. We have semi-private hygiene bays. So if a parent is walking up and down the halls and we want to use our diode laser for laser bacterial reduction, we use that a lot in our hygiene care. And so as you can see in this example, what would I do about protecting a passerby in the hallway? So we had to get a little creative, and we were able to purchase these screens, and we created our own sign and put it on the screen. So if we have a patient that's being seen in hygiene and we see, you know, atrocious puffy gums, plaque everywhere, gingivitis, and we talk to the parent and say, hey, we've got laser bacterial reduction that can really help your kiddo. Is that something you'd like to proceed with today? Parent says yes. We've got our diode, our safety glasses, everything we need for laser bacterial reduction on a rolling cart. And we're able to just roll it into the hygiene operatory. And then we've got our foldable screens that you see in this photo tucked away. And we just pull those out and prop them up to cover the entrances of that hygiene bay. So that was our creative answer to ensuring that when the diode is being used, how do you keep people in that margin of safety protected? We have windows that are tinted and that we have blinds in our private ops, and we have bushes outside. So somebody made the comment about, you know, what about if somebody was looking through the window? I think if we had somebody coming through the window, through the bushes, we've got other problems. But we are protected. Or anybody looking through the window is going to be protected. So just again, something to think about when you're looking in your space. How are you making sure you're making those accommodations? Here's a zoomed in version of the signage on the screen you saw in the previous photo. And this is just, you can see on here that it designates myself as the laser safety officer, and it talks about what we have on the premises. Again, this is per our state rules. So you'll want to look into what your state requires. So we've gone over this one already. And maintenance kind of goes hand in hand as well with safety. So how do you keep your laser safe? And so you'll want your RDAs helped and trained on proper setup, proper cleanup, checking the tips of utmost importance, and making sure that they know how to check for the tips and when it's time to discard a tip, caring for the trunk fiber of utmost importance. Obviously, you want to protect your investment and keep it safe. So setting up your quarterly maintenance with your Waterlase rep, a key resource in helping you there. Very happy to help answer questions and help train your team to make sure your investment is protected. But just I throw this in there as a reminder that bringing your RDAs into the fold is going to be important to make sure that you are meeting those checklist criteria of making sure that your laser is protected. So here, I just wanted to include just resources that I utilized early on in my laser implementation journey, if you will. Biolase.com has many resources, free webinars, and a library of webinars that you can use to train yourself on, train your laser safety officer on, train your team on. They have a link to the World Clinical Laser Institute resources as well. And many of those are free and great resources and webinars to take advantage of to help with your training, again, of both yourself and of your team. Early on in my career, Academy of Laser Dentistry, their website and their programs, they had many great resources. They often have a separate pediatric track of training. And of course, we have, I think Dr. Curtis, Nathan mentioned he's listening in today. Dr. Curtis and I work together. He's helped me with my patients for the last 5.5 years. He was an associate in my practice, just a real, for those of you who've had the opportunity to listen to Dr. Curtis and meet him, you know why I love him. He's about to start his own practice, so I'm very excited for him. And he's our executive director for the Waterlase Academy of Pediatric Dentistry. So just a phenomenal resource. But he as well, we went to many Academy of Laser Dentistry seminars, and now he's helping create his own seminars. So again, there are resources is the point. So again, I'm going to backtrack here a minute and say all of this can be very overwhelming. So again, what are we doing to tackle this like we do with any other thing in our practice, any other technology, any other situation, COVID, et cetera, is we break it up into biteable pieces. And so here we go. We've got some resources and we've got some things to think about. And your resources are available online, your reps, et cetera. So you've got some helping hands here, and I encourage you to reach out and utilize those to make yourself comfortable, utilize your resources. Okay, so I'm going to keep moving here through our presentation. And I've already alluded to this about having your team in place and being your cheerleaders and helping you. And I can't stress enough the importance of the team and bringing them into your laser implementation journey. They're going to be key. So as you can see here, just a lot of different things to talk about and think about with your team. And I would say, at least what I found in our practice, the RDAs are so excited to be a part of an office that offers advanced technology. They see it. They see what we can do with laser technology to help our patients. And they are so proud of being a part of that appointment. I have multiple examples in my practice that my assistants, I've seen literal tears in my practice that the assistants have when they call and follow up with these patients, and the patients tell them how the appointment improved the quality of life for the child. And the assistants, especially in a pedo office, a lot of them work in a pedo office because they want to be a part of making a change in this kid's life. And they know in the pedo practice, they're able to be a part of that journey for that patient. And so just bringing your assistants into the fold, I cannot stress the importance of that. I mean, just for ourselves, for me, they're the ones who are like, come on, Kuba, use the laser. They were the ones who were, I was kind of older, set in my ways. You had Dr. Curtis, who, was in the practice. And I'll be honest, I'm not a super competitive person, but when my laser said, oh, really? Dr. Curtis was able to do X, Y, Z with the laser. Man, that lit the fire up under me. Oh my goodness, the new kid on the block is using the laser. I better get my act in gear. And, it's the assistants that really helped motivate me and be my cheerleader. And like, you got this, doc, you got this. We've got you set up. We can do this. And so I think that's a really important part of the integration and implementation. As a side note, the other thing that I have inadvertently found was certainly not my goal at the outset, but certainly I see it now of utmost importance in today's day and age, where it is really hard to find good help as a result of the pandemic and all the challenges that that's brought on. But assistants that want to be a part of a cutting edge office. So as far as me being able to retain good talent and attract new talent, I didn't expect that to be a benefit, but it's been a side benefit that I've been able to attract good talent because they know we've got advanced technology. Attracting associates in Dallas Metroplex, where I practice, there are many job opportunities for associates. And so I think being able to be an office that where we do have the technology, I have been able to attract associates and help like Dr. Curtis, who joined us and was very excited to use the technology. So this is a side note, that's a side benefit. Okay, back to getting your team to help you. Verbiage for the patients and how are you going to talk about the technology in your practice? I think a mistake, if I can call it that, that a lot of us do initially, I know I did. Okay, we've got this new equipment, we've got this new technology, and I've kind of erased that from my verbiage now, because you do have some patients and parents that are like, ooh, new technology. And you've got equal number of patients and parents that are like, oh, is my kid going to be the guinea pig here? So I learned quickly to take that out of my verbiage. And I just consider, even in my own mindset, this is another tool in my toolbox. And I think a lot of us put pressure on ourselves. And rightfully so. We've just invested a chunk of change in the technology, a chunk of change in time in getting competent with the technology. And it is, oh my gosh, there's so much pressure on this. I've got to use this laser. And I would just kind of like to throw in that it's a privilege and it's a fun thing to be able to use new technology. And it's another tool. So don't put that pressure on yourself or on your team that I've got to do it with this laser, only this laser. No, I use my my high-speed handpiece. I use my slow-speed handpiece. I use my Waterlase. I use my diode. It's another thing that opens the door to be able to offer more things to our patient. And that's the ultimate goal, right? Like we want to be able to provide more and better services to our patients. And so keep that in your mind. So for example, verbiage for our patients. I don't use it all, oh, we're trying this new technology on you. It was, I'll be honest, I did that at the beginning, then quickly realized that was not something that was useful for the majority of patients. So we all have our own verbiage, Dr. Curtis. If you're still listening here, I know Dr. Curtis's verbiage, or I think you at one point used the popcorn. Okay, we're gonna pop some popcorn. And what kind of popcorn are we gonna have? Is it gonna be butter popcorn? Do you smell that? Now, for me personally, I used that at the beginning, and then I thought, man, I feel kind of duped. We're talking about popcorn, the sound that the laser makes, but I want some popcorn now. So my verbiage is, hey buddy, I've got a couple of different brushes I might use to get that sugar bug out of your tooth. I've got my spinny brush that touches your tooth and sprays water. I've got my spinny brush that touches your tooth but doesn't spray water. And my most favorite of all is my brush here that sprays water. It makes a loud noise, but it doesn't even touch your tooth. I find that it's almost magical. I love it. So I'm going to start with my brush that doesn't even touch your tooth. You're going to hear the water droplets. That cavity is going to be flying off your tooth, and you're not even going to feel anything touch your tooth. You ready? I'll let you know when I'm about to use the brush that does touch your tooth. So that's the verbiage I've started using, or I've used for a while in the practice. And I get started with my Waterlase. Hey, isn't that cool? Oh my gosh, the cavity's already flying off your tooth. Yep, it sure has. I know you didn't feel it, but it's flying off. I'm going to make my water droplets bigger now. We've gotten a lot of that cavity off. Let me see if I can get the next layer off with bigger water droplets. So that's when I'm transitioning to the next setting. And it's easy peasy. It's easy peasy. They're not even thinking about it. They're so relaxed and happy that nothing's touching them. And that helps them, put them at ease. I think a lot of them love the popcorn analogy as well. So utilize that if it works for you. The assistants love, I know one of my assistants loves talking about the helicopter that's flying around in the room. So whatever works. Same with the parents, whatever verbiage. If you know it's a parent, in our area, we have a lot of engineering parents that's their career. So they love knowing that we've got a laser and advanced technology. We've got an equal number of parents that are terrified of a laser. What do you mean? So just practicing your verbiage and seeing what works in your practice and talking with your assistants about what you think will be the most successful verbiage. With the assistants, knowledge of the procedures, knowledge of your settings, of your tips, of the hand pieces, how to clean everything properly, how to keep your safety glasses cleaned properly so that you're not wearing out the protective coating on the glasses. So, et cetera. There's just things that you're going to want to talk to your assistant team with and get them on board. Appropriate documentation. How stringent is your state board about documentation and the type of, so for example here, if I'm not using the laser, it's just handpiece used to excavate decay. If I am using the laser, now I've got to indicate what tip I used, what hertz we use, et cetera. So create some templates if that's helpful for you and your team. Equally important is training your front desk. And it was really funny to me, this summer, we have our local dental conference that happens every year. And I send my team and I pick their courses for them because I there's certain things I want my team to learn. And it was funny because I had 2 team members from the front desk that I signed up to take the intro to lasers and what types of procedures you can do in your practice. And when 2 of them came back, I said, what do you think of the course? And one of them said, so you meant for me to go to that class? I thought it was a mistake that you signed me up for that. And I said, okay. And I asked the other one, well, what did you think of the class? And she said, no, I was really happy to go because I hear us talk about the laser, but I wasn't able to connect what that meant and what the technology could do. And I've heard you talk about it, but I didn't get to see it. And so now going to that course helped me see what the laser can do. So I turned to the first assistant and I said, that was kind of the point. So no, it was not a mistake that I sent you, but you answer the phones and you put estimates together. And if you're going over an estimate and a parent's asking you about the laser, not that the laser's on the estimate, but just when we talk about a procedure that we can do with the laser, and you have no clue that we offer this technology, or a patient has seen it on our website, they call in and you're not able to talk about it, the office looks bad. So yes, the front desk needs to learn about the procedures that are important in the office. Do they need to get into the nitty gritty of the deionized water that the Waterlase needs? Maybe not, right? But it's very important in my opinion, for them to know what the services the office offers so that they're your cheerleaders for the office, and making sure the parent gets the technology, the patient gets the benefits of the technology that you have in the practice. So I'll be honest, I was a little disappointed in my assistant, or my front desk that I spent, and I was like, that was your takeaway, that I put you in the wrong class. So we had to have a good talking to there to say, no, it's important that you know what your practice offers. How to bill. So it may be illegal to charge more using the laser. Again, at least in Texas, this is just another tool. The insurance companies don't care what tool I use. Did I use my spoon excavator to excavate the entire decay? Did I use my slow speed only? Did I use the laser? They don't care. The point is I did a composite. But I know some offices do charge more for the advanced technology. So if you're a fee-for-service office, I've heard of offices that say, you know, if you want us to use the laser, it's going to cost this much more. So there is a legal component to that. But if you're a fee-for-service and you're not bound to an insurance contract, might that be something you utilize? I know in our practice, we don't. We've got a very suspicious population that they want to make sure they're not nickel and dimed for anything. But you know, if I'm doing a composite, I'm not billing any extra for the laser, but certainly that's something you could look into. Now, I will say we do create a code. And when I say create a code, if we're talking about a composite, a 2390, we do have the 2390L for laser is what we decided in our practice we wanted to use. And the reason for that is if we ever wanted to run a report on how many, you know, what is my ROI here? Have I used the laser, and what codes am I billing out the most? What am I using the laser most for? What increased revenue were we able to do with the laser if we're adding in sternotomies or biopsies or things like that? And it just makes it easy to track that, to be able to run reports and pull it out of your software to put in the code, you know, D4210L. And so the assistants help with that as well. So if I use the laser on this stainless steel crown preparation or for the pulpotomy, we'll bill out the pulpotomy or we'll bill out the stainless steel crown, but the code we use would be L. Again, the insurance company doesn't know what that means. They're going to pay it the same, but for tracking purposes, we have our own code in. So it's something to think about as you're setting up and implementing your laser. Okay, so getting to more of the, again, not so glamorous parts of the integration, but again, very important. Consent. For your hard tissue procedures, you probably don't need to mention that you've got the laser on the premises, but that's, again, something you may want to check with your state board. So for example, if I've got on my consent form that we're using nitrous and we're doing a occlusal composite on 30. Well, I typically don't put in there that I'm using a high speed and a slow speed and a spoon excavator. It's just we're doing the composite. So in that case, this is just another tool, an adjunct to my other tools. However, if you are an office that's planning on integrating soft tissue procedures that perhaps you didn't do before, and again, maybe you were doing sternotomies with a scalpel, maybe you were, you know, using a scalpel to remove pathology and send it off to a lab. I know personally on my pediatric patients, I never touched any of that with a scalpel. No, thank you. But with the Waterlase, it's opened up a lot of things that I can do now and help our patients with. So we do have specific soft tissue consents for pathology removal. We've got different paperwork in terms of post-operative instructions. And we have two sets. We've got one for baby sternotomy because there are certain things that we want the parent to do in that case. And then we've got other instructions for older kids that maybe were sent by the speech pathologist to get a tongue tie addressed. So, or they were sent by the orthodontist for a frenum release for a cosmetic finish in the anterior. So we have different sets of paperwork and instructions. So certainly if anybody's interested in a consent form or anything like that, you know, we have examples that I'm more than happy to share. You can email me with that and I will be happy to share what we use in our office, and you can customize that to your own office. In-office brochures are a great way to help patients. I know Waterlase Biolase has great brochures to help you too. And so that's another resource. Could you create your own talking points of why you utilize the laser and what you can use it for and the benefits? Certainly, that's another option as well. One area that I think is super exciting is the marketing. To me, this is more fun because it customizes your practice and it really puts you out there. And even if it's for procedures that you know, it just helps make your practice more visible in the community. So what do I mean by that? When you have outreach to other providers in your area, for example, we have marketing, what do you call it, folders or papers or packets that we put together for the orthodontists in the area, because I want them to know I can help you uncover teeth. Now, certainly, you know, there are limitations on what I'm comfortable with, but there are things that we can do that can make it nice and easy for the orthodontist and coming to our patients, coming to our office to help our mutual patient. A lot of times the patients are intimidated going to the oral surgeon. And this is something that we can help with. We can help with gingivectomy of puffy gum tissue. And I know this is a big concern for the orthodontists in our area, in not wanting to be in the situation where they know the patient is struggling with oral hygiene. And the thought of the appliances coming off, gum tissue receding back and not being so puffy, and finding all of these white spot lesions that are about to start cavitating, I know that is an orthodontist's worst nightmare, and the potential legal ramifications that come to that. Well, could we help you and do a little gingivectomy on the overgrowth of tissues of papillas so that the patient can access the tooth surface to keep the area clean? We offer, you know, these procedures that are minimally invasive, that are minimally uncomfortable. And I think some of our patients that go back and report and say, yeah, that was easy. No, I really wasn't that sore. And the parent is thrilled to be able to invest in something that can help prevent cavitation on permanent teeth, especially in the anterior small zone. So the orthodontists in our community love that we offer this, but I think for a long time, I never told them that I was able to help them with this. And it was just in casual conversation where we mentioned things and they said, wait, what? You can do what? And so that was really exciting for me and my team to say, oh, you know what? We can put together a marketing packet so that orthodontists know that we offer this service for pediatricians, knowing that we can offer an easy peasy mucoseal. I cannot tell you how many pediatricians in our area that, well, I'll put it this way, that who knows how many. I can just tell you what came across my doors, and it made me shudder. It made my staff shudder. The number of pediatricians that were referring a mucoseal to ENTs, calling it a cyst. Fair enough, the pediatricians don't know a lot about mucoseals. A lot of them aren't familiar, but the thought, I mean, we've had multiple patients that were in our office on recare. One little girl I remember in particular who was a recare patient, and I said, oh, she's got a mucoseal, you know, if it doesn't go away. The dad said, it hasn't gone away. Our pediatrician told us it was a cyst. We have an appointment next week with the ENT. And I said, with the ENT, not with the oral surgeon? No, with an ENT. We have our general anesthesia appointment with the ENT. And I was floored. And I said, okay, you know, this is something we can do under nitrous with our laser. This is a very straightforward procedure. I spent the next hour talking with the dad because he did not think I understood what he was talking about. He did not think, because the pediatrician had told him it was a cyst and it had to be seen by the ENT. And it finally came to, I said, sir, Google it yourself. This is something I can help you with. If you'd prefer to have your child under general anesthesia with the ENT, that is certainly an option. Off you go. But if this is something you want to try with nitrous in our practice and avoid general anesthesia, that is something we can certainly help with. So just, again, letting the pediatricians know that this is something we have. We can help with infant tongue ties, lip ties. We can help with pathology. So it's really kind of a fun thing to do, is to be able to help in the community. And of course, the pediatricians, once they realize that you are, first of all, an authority on the mouth, they, for some reason, they kind of forget about us often, but it's a gateway to help make those connections with the pediatrician for other patients, and for, even if there's not a tongue tie situation, but just you're up higher in the pediatrician's eyes, that you can offer technology and that you are well versed, and that you can be a partner with them in helping your patients. So very exciting to be able to reach out and let people in your community know what all you can do for them. And then we've also had the opportunity to make some great connections with lactation consultants and speech therapists and chiropractors. I know across the country there are a lot of communities where they have kind of a group mentality and they cross refer. And in Dallas, that's still really not super common. I mean, there are little pockets of people, but not, I remember in 2015, that was a challenge, was going, okay, who are my partners in helping be supporters in this therapy? For example, if it's a tongue tie on a 15-year-old, I can release the tongue tie, but I want to make sure that they're in with the right therapist or the myofunctional therapist, et cetera, to help make the maximum efficiency of the procedure. So being able to reach out to these different providers. And of course, if this speech therapist knows you've helped their tongue tie patient, if they're at a soccer game with their kids and they're like, well, if I had a choice of who I would send my kids to for their, general pediatric preventive care, this is the doc I want to send to, because they know we have the advanced technology and we're able to help and partner with them and support their business and their practice as well as ours. So it does, all of these different avenues of connecting with other providers really helps your other, even if they're not sending patients to you for pathology, they know that you are leading cutting edge and you've invested in helping. They want to help you build your practice and support your patients because you're doing the same for them. So I think it's a really exciting component of being a laser provider, being a Waterlase provider. Okay, so of course I'm in Dallas here, Dallas Cowboys. We did not have a good weekend. Let's not talk about that. But again, having your cheerleaders. So my 2 cents, and I've kind of talked about this already in the presentation, but I think when it gets challenging, again, the clinical competence is a lot of the challenge. And then the implementation, we've just been through so many points and things to think about. And so to make sure that it doesn't overwhelm you or put you in that category of, never mind, I'm just going to stick to what I already have. I may not be ready for this journey. You are ready for this journey. And I think I'm going to challenge you and encourage you to think about, what is your why? And this ties in with, what's your vision and mission? You're listening to this for a reason. You want to be a laser provider for a reason. And going back to that is really helpful when you get kind of stuck in some of these implementation points. And if you do feel overwhelmed, going back to, well, why do I want to be a laser provider? Why is this important to me? And going back to I know this technology is there, and I know I can do better for my patients, and I can do better for my practice, and I can do better for my community. So going back to your why will really help you take that deep breath and pause and go, okay, I got this. Like, let's keep going. So remembering, why did you want to be a Waterlase laser provider to begin with? And then bringing your team with you. I think I've stressed that quite a bit, and I'm going to continue to stress it. They're going to be your cheerleaders. So have your cheerleader team in place that when you get frustrated, they're there to push you along and keep you going and help say, hey, doc, I got this. We got this. And I think that's going to be super important. I know that's been, again, super important in my practice, and making sure that my team is on board with me, and they've been critical in this journey of implementation. And again, now, it was an initial bump, an initial challenge. Once we sorted through that, our consents, our templates, our tips, our marketing, like, now it's easy peasy. It's smooth sailing. It's just something we do. And it's smooth sailing. It's you tackle it once, and then there's really not much to be done other than maybe, you want to tweak your consent here. You want to, add that there. Oh, I do want to say, I kind of got ahead of myself here. I'm going to go back here for 1 minute. Another key thing to remember to do in your marketing plan, update your website and add that section to your menu of services. And you're going to get to where you're going to take before and after pictures. Now, somebody like Dr. Curtis, who is very tech savvy, he wants to keep his Instagram up to date, and he's very knowledgeable on how to get the picture he wants and he's done it so much. I'm kind of an older bird. I don't Instagram. I don't Facebook. We have it for the practice, but for me personally, it's not the first foremost thing that comes to my mind. But the team sees him doing it, and the assistants are like, no, we need to brag about this. So they will come in with the iPhone or whatever system you've got to take pictures. They'll be the ones to say, Kuba, we're not done yet. We need to take a picture of this to have before and after. So remembering to include those photos on your menu of services, your search words, updating your search words and in your SEO and all of that. So don't forget to do that part, because that's really helpful in the parent that is tech savvy and is technology savvy and knows that they want lasers. In Texas, at least, we are at a point now where we have people all over the country coming into Texas. We've got a ton of people implanting in from California and New York and all of these other places that laser usage was a lot more common. And so in Texas, it's become very important for us to make sure in my practice that we update our website and our search sites so that people coming into the state and are looking for the technology can find me very easily. Sorry, I got ahead of myself there, but I wanted to make sure we touch base on that as well. Okay, so to kind of summarize and wrap up here, I know we've talked about a lot of different things. So we do have our little checklist, little things that we've talked about here. And we also have this in a PDF format that if you want this, then certainly you can email me or email your Waterlase rep. They'll be happy to get that to you, so that you are kind of going, okay, yes, I'm overwhelmed, but no, I got this. I've got my checklist and I know what I need to do. And you can start quarterbacking your plan and figuring out who's going to help you. A little encouragement. This is my kiddo. She saw this at a store. We were giggling about it, and we got this. We've got this. We've done enough challenging things, at least over the last year and a half, and we can do this. Please don't be one of those docs who stops in their tracks because they're scared of implementation. We got this, y'all. So again, if you have any questions, I left a little bit of time here to address any questions if anybody has them. Here's my email address if you need anything addressed. Please feel free to email me or email your rep at Waterlase and they can get me your question. Okay, I feel like I've been going 1,000 miles a minute here. What
Thank you so much,
do we
Dr.
have
Kuba.
here?
We do have a couple, but please feel free to add some more to the Q&A tool at the bottom of your screen. One of the first questions we had was from June Murakuru McCollum. She's asking where to buy those eye patches that you had on the first couple slides.
So we, at one point, there's a company called Sedation Resources. And so I believe we used to get them on there. When I looked more recently, I didn't see them on there. So I think even just Googling on Amazon seems to have everything right on there. So that would be a great place to start. If you are having trouble finding them, please email me and I will get back with my assistant and see where she purchases them now. But I know Sedation Resources was our initial resource for finding them.
Oh, that's great. And also, we did have a lot of expressed interest in the consent forms.
Sure.
So perhaps you can give us some examples of the consent forms and we can have it emailed out to the participants afterwards.
Absolutely. And again, these are consent forms that we have just created in our office. So certainly if there's parts of the verbiage you want to pick and choose, absolutely, we can send you that, and feel free to customize it to your needs.
Okay. We had a question from Dr. Mosen. Is there a difference in law to use the Waterlase in different states? He was wondering about the law in Texas versus other states.
Do you mind repeating? So what is can we use lasers in Texas versus in other states? Is that the question?
He was wondering about if there are any generalities as to different laws for different states, or is there kind of one standard for Waterlase?
I will be honest with you. I believe it's really with every state has their own set of rules, is what I would imagine. I mean, how much could it be? My guess would be, I've not looked into what other states require, but my guess would be there's got to be some component of safety measures, and also that you've taken CE. And different states, I'm sure, have different requirements as far as how often you need to take renewal CE. It's funny, in Texas, the dentist has to take an initial set of CE. Hygienists are required to take their CE more often. So it just varies state by state. So again, I don't have a specific answer for you, but I would absolutely just look into your state board rules to see what they require.
Thank you so much. And Dr. Ben Curtis has messaged us saying to reach out to your own state dental board directly as well.
Yep.
So thank you, Dr. Curtis. Additionally, we had one last one. Which course would you recommend for the tongue tie and lip tie surgery?
Oh, I don't know, Dr. Curtis, I won't steal your thunder here, but can I make a plug for that? If I can't, I'll talk about something else here in a minute. Now there are many useful, I love Dr. Baxter's book on tongue ties. ALD still offers, the Academy of Laser Dentistry still offers, they have a pedo-specific track that runs for 2 days. Excellent course there. Nathan, did Dr. Curtis reply in the comments? Can I talk about?
Yeah, he said, oh, here we go. I think we have him online with us too.
Hey, can y'all hear me?
Yes, Dr. Curtis, welcome.
Hey,
Surprise
hey.
guest.
Yes, coming in here at the end. I'm just gonna let everyone know we have some information coming out. We have a great tequila and tongue tie conference coming up in April. So that's a great question. Additional resources. There's lots of tongue tie resources out there in different forms and fashions. And at the same time, there's not hardly any resources out there in any form or fashion. And so BioLace has really had a big push over the last couple of years to try to help their providers be able to access more resources for particularly tongue ties and becoming better educated on that and everything. And so this April, we are going to be hosting a meeting in San Antonio, Texas, and we're calling it Tequila and Tongue Tie. It's going to be a collaborative, comprehensive approach to tongue tie, where we're bringing in different multidisciplinary approaches, from chiropractors to lactation consultants, speech and myofunctional and pediatric dentists, all alike, coming together to discuss that. And so more information should be coming, and we can send out more of that information to you as well. But that would be a great resource there, coming from BioLace sponsorship themselves. So keep an eye out for that.
And I am very upset because I cannot make the conference, and I am so bummed. I have a family wedding to attend, and it's heartbreaking to me to miss the first annual Tongue Tie and Tequila conference. But in order to go back to the question that was asked, what is the best resource? It's an onion layer. It's an onion layer of different resources and different things. Again, I went to the ALD conference. I thought that was really helpful for me personally. But I also flew out to a colleague of mine, and I watched in her office. But again, that's my learning style. I kind of wanted to see from front to back, to paperwork, to verbiage, to all of that. So I took that upon myself to go fly out to her office. Certainly could BioLace sponsor more conferences, or somebody flying out to your office. There's different options, but I would definitely say ALD was one of mine, but there are many resources now. I know AAPD also, what was it, 2 years ago, I believe, had a symposium, and I think you can purchase that on APD's website to go back
Yes,
and listen to that.
It should still be available. Yeah.
Yeah. So not to make it too gray, but bottom line, everybody has their own little tips of things that they want to incorporate. And so how do you customize it to yourself is kind of the point. And so the more you learn and see, then you can kind of go, yes, I like that piece. I like that part. And I want to be, this is how I want my protocols to go. So in a way it can be overwhelming, but on the other hand, it's good that you've got options and you can piece it together in what's going to suit your patient's needs the best in your particular office.
Well, Dr. Kuba, that's all the questions. And thank you so much to Dr. Curtis as well for joining us.